Dr. Malone, Joe Zarzaur here. Thursday, March the 19th, I think. Is that right? 19th?
Yep.
And downtown Pensacola is becoming more and more of a ghost town. I think the mayor has ordered that all the restaurants have to go to takeout. So that's different than yesterday. And I got a call from a couple of friends that own businesses downtown. They are shutting down today. The consensus is that business has gone down 25% more than yesterday. So I'm not sure that's a scientific number, but that's where things are from a downtown business standpoint. There's not a lot of, I can say that the foot traffic has decreased substantially in a day. And right now it's 5 o'clock and there's barely any cars on the road in downtown, so which is very unusual. Anyway, that's not the purpose of this video. The purpose of this video is for us to hear from you, Dr. Malone. What is the latest on the virus? What are the stats in town? That kind of thing. What can you do to help us get through the next 24 hours?
So I guess the daily news rounds, I won't focus too much on the national or state level stuff, more locally here. It's still just with one confirmed case in Escambia County, 2 in Santa Rosa, 4 in Okaloosa, and 1 in Walton. In watching the press conference today that the city put on in coordination with multiple other, entities, the one test site that's been going on all week since Monday's got 674 pending tests, which are not yet resulted. And 28%, they have a 28% test rate, meaning so of the people that are calling in, 28% of people are being tested after they've made through the phone triage. Two other test sites will be opening up by the end of the week. One at Brownsville Community Center, and then Baptist Hospital is going to be coordinating to have at least one test center, undisclosed location at this point. And all the hospitals have reported that they're, trying to streamline their testing so that they can offer testing in-house with results in-house on hopefully a more rapid turnaround.
All right, and then I had heard something about a blood test correlation. I know you have some other topics you wanted to touch on.
Yeah. So I guess 2 other exciting developments that have come out in this. This is more worldwide application. One of them was Chinese researchers were looking at the susceptibility of blood types in regard to the infection of the virus. Someone had noticed that there was some correlation, and so they put out this study rather rapidly. It hadn't been peer reviewed yet, which is atypical. And the idea is to get this information out as soon as possible so that hopefully other researchers around the world can maybe, piggyback on this and make it into something useful or applicable. So to quote their words, and it's a little bit difficult to follow, based on your blood type, the A or B or AB or type O, and in the United States, type A is about 42% of the population and type O is about 44% of the population. And type B being 10% and type AB being 4%. So don't worry about all those numbers, but when I read this to you, it says that people with the blood type group A have a significantly higher risk for acquiring the virus compared with non-A blood types. So if that makes sense, it basically is type A people are more prone to it based on their data that they've collected. And then along that same line, blood group O has a significantly lower risk for infection in those groups. So bottom line is if you're A, you have a higher risk of getting it. If you're O, you have a less risk of getting it. Now, how does that apply and what do we do as far as identifying who these people are? It doesn't mean that if you're type O that you can stop doing everything that we've been told to do. So it's just trying to apply it to the population. So that's an exciting development, but the publishers left this wide open with the intention that hopefully this can be just a stepping stone towards something more applicable. More exciting than that was, I think I mentioned it this morning when Joe and I spoke, was the Plaquenil drug that you had seen in the news today. It's a malaria drug, anti-malarial drug, hydroxychloroquine, more commonly known as Plaquenil. And this is a common drug that has been used for a long time. Most people at home probably know someone who's taken this drug when they've traveled somewhere where malaria is endemic. So if you've taken a trip or vacation to Africa, some tropical location, on a course of Plaquenil for a couple of weeks surrounding your travel dates. So this is something that researchers have identified across multiple countries, that this in combination with Zithromax and the small study that they did was successful. And this is what the federal government came out with today on a expedited approval track overnight from the FDA as an indication for use in people who are infected with the virus. And this would be a huge step, because if you can treat the people that are infected, you limit their passing it on even further. So once you identify the infected people, you treat them with this immediately. And the manufacturers of these drugs are basically saying, we'll donate the drug. And in France, the company that owns that manufactures the drug basically saying, we have 300 million doses, and we're ready to ship it. So this would be a huge thing. And this was, again, like I said, this was a peer-reviewed study, and I'll read you the findings because it's pretty, you don't need to be a scientist to understand this. They said, despite the small sample size, their study shows that Plaquenil, it's significantly associated with viral load reduction and or disappearance of the virus in patients, and its effects are reinforced with Zithromax. So we've all taken the Z-Pack, or we've known someone with the Z-Pack. So Zithromax and Plaquenil in combination right now is going to be hopefully something that is beneficial to try and bring that curve even further down, as we were talking about the other night.
But not by itself, not Z-Pack by itself, and not Plaquenil by itself. Is that right?
Correct. Plaquenil is the initial drug that you need to be on, and then Zithromax is kind of like putting gas on the fire. It helps potentiate that effect.
So when do we go and get prescriptions from our primary care physician for this stuff?
Chances are, and they didn't get into all the specifics on this, that this isn't going to be something that you can get a prescription for. This is going to be one of those things, and the closest thing I can equate it to is someone who's infected with tuberculosis. So if I had tuberculosis, I wouldn't have a choice on taking the drug or not. This is something that the health department basically mandates you are treated with, because it's a population health thing.
And they'll do some kind of mass if it works. What else is left to decide whether it works or not? They had a study. Now, what else do they do?
Well, that's the thing. They had the study, and the FDA did an emergency approval over the course of 24 hours.
So I guess they'll just
is unprecedented.
How those patients react to it, and if those patients that are treating with it right now react well to it, then they're going to probably make everybody just take it. That kind of thing.
Well, the study wasn't done for prophylaxis. The study was done on infected individuals. So anybody who's testing positive would be on a course of this immediately. And the idea being that you're stopping the virus in its tracks in the known infected people. And as more people test positive, you keep putting those fires out effectively over the course of time. You bring that whole curve down. Okay. So this is better than nothing. And to have a treatment for a virus, I mean, this is huge. And they relied a lot on what we've learned from viruses over the years, just starting back from HIV. This is stuff that 25 years ago, 30 years ago wouldn't have even been thought of.
All right, very good. All right, so that's some pretty helpful and hopeful information for today. We had a fairly productive day in the office again. We met with several clients. We had a couple of intakes today. The firm is staying busy, actually. I'm over in Destin tomorrow, meeting with some new clients in the Destin office, and I'm going to try to come back and do a quick video tomorrow afternoon, so we can give an update. If I can't get back to the office tomorrow afternoon, I'm going to do it remotely from someplace between Destin and here. So we'll make sure we do a daily update with Dr. Malone, so we can help keep us posted on what's going on. Any other links we want to send people to today, Evan?
Well, I can link the two studies that I shared. I mean, they're pretty impressive. I mean, just from a historical perspective, I think they are more than anything, and then hopefully they're applicable as well.
Very good. All right. Thank you, Dr. Malone, very much, and we'll touch base with you guys tomorrow afternoon. Stay safe and healthy.
Thank you.